Hello, and thank you for joining us for today's hybrid education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop titled Exercises for Osteoporosis. Before we begin, if this is your first time joining us, CSC South Bay's mission is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. Our vision is that everyone impacted by cancer receives the support they want and need throughout their experience. We serve the South Bay, Long Beach, and Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational programs like this workshop. Educational programs are open to all. If you'd like to hear more about our services or join our community, please visit our website at cscsouthbay.org. Before I introduce today's speakers, we ask you to keep your microphone muted to eliminate any distracting background noise. Please feel free to enter any general questions into the chat function found at the bottom of the Zoom window at any time. Without further ado, I'd like to introduce our workshop speaker. Dr. Sarah Shimanek is the co-owner of a private physical therapy clinic, Akasha Physiotherapy, located in Long Beach. She is a board-certified clinical specialist in women's health physical therapy and is certified in pelvic rehabilitation. You can see more information about at our website, akashapt.com. Thank you so much, Dr. Shimanek, for being here with us today.
Okay, well, thank you all for joining us, both on and welcome. So Becca already introduced a little bit about me, so I'm going to kind of skip that part, specializing in women's health and pelvic health. But let's talk a little bit about our agenda for today. So we're going to talk a little bit briefly about, just for some context, T-scores and osteopenia, osteoporosis, why that matters, what are risk factors, and then what you can do about it, including some exercises. And we'll talk about different exercises, and then we will go through some exercises all together. There are some options for improving density. And then we'll give you some resources and things for help. Fine. Give some resources if you need extra help too, where to go for that. And then we'll open it up for questions. So I'm more than happy to answer some questions, but we're going to save to the end after we've kind of presented all the information in case we are planning to go over it later. So first off, bone density, right, is just referring to the amount of bone mineral in your bones, right? Traditionally, that's tested by a DEXA scan, which is an X-ray that sees how much in the bone or how many there are, like you can see on the slide there. There's actually a newer technology called REMS. I'm trying to think of what that stands for. Radiographic electro, no idea. But it's an type of ultrasound. Is this working? Oh, okay. Okay. It's a type of ultrasound technology that also can test your bone mineral density and give you T-scores as well. And obviously, if you have lower density, you're at higher risk of breaking it, right? Because it's thinner, there's not as much there. So that's the big reason why we care about that, right? So, you may have gotten, if you've ever had one of these scans, you get a T-score, which tells you if you have normal bones, osteopenia or osteoporosis. And it's just based on that T-score, which is just tells you how far off you are from the bone density of a 30-year-old, right? So like none of us are going to be perfect at a 30-year-old because none of us are, I don't think, 30 anymore. But, if it's between 1 to 2.4, that's osteopenia, which just means, hey, your bone density is a little bit lower and you need to be doing something about that or, trying to take care of that before it gets to osteoporosis. And if it's 2.5 or below, then obviously that's osteoporosis and you need to be a little bit more careful. So why does that matter? Like we said, more likely to break a bone. Also, you often have a lot of people with low bone density also have poor balance, so if you have poor balance, then that's a higher risk of falls. And if you have a fall and you have low bone density, you're more likely to have a broken bone. And that's a huge risk factor for nursing home admissions. So 40% of all nursing home admissions are due to a fall. And there's a lot of other potential complications afterwards. So there's a lot of good reasons to try to avoid that. And risk factors, right? Obviously, the older you get, the more likely you are to have some kind of lower bone density. Women are more likely than men, just because. And if you have any kind of muscle weakness or atrophy, you're going to be more likely to have lower bone density. And then anything that causes for women a decrease in estrogen, which in the natural course of life can just be menopause, but also if anyone has their ovaries removed or is taking any estrogen suppressing drugs after maybe breast cancer treatments, those are also things that can escalate bone density loss. Radiation and chemotherapy also can affect bone's ability to regenerate near the site that the radiation is given, and chemotherapy obviously everywhere. And the other things like smoking or alcohol abuse, low calcium intake, and along with that, just poor nutrition in general and eating disorders can make people higher risk for lower bone density. And it affects 50% of postmenopausal women. So, you're not alone if you're dealing with this. I also think it's interesting, our peak bone density is between ages 30 to 35. And after that, it just starts going down, it's just always for everybody. A couple of eyebrows over there. So, I mean, you really do need to do something about it, or else it's going to keep going down, right? If you do nothing. And it also, the rate that bone density goes down, it's higher the older you get, right? So not only is it getting lower and lower, it's falling at a higher speed, at a higher rate, the older that you get with each passing decade, which those graphs kind of show that. And they also show, that's not totally fair for us here, the women in the room, but how much less men, it doesn't go down as much as it does for women, right? You can kind of see that on the graph. The men are on the top and the women are in the bottom, and the women's curve kind of tanks there, yeah? So just so you know. But good news about that, there are things that you can do about it, right? Exercise is a big one that I think sometimes gets missed. Some doctors I'm hearing are talking about it more recently, but there's a lot of really good research that supports exercise as a treatment for osteoporosis. And the main traditional research on that is basically for high intensity, lower repetition strength training. And that's what helps the most. Lower intensity, higher repetitions doesn't help as much, right? So we're thinking about just like lifting some 2-pound dumbbells and doing like 50 of them isn't really going to do anything to help your bones, but lifting maybe some 10-pound dumbbells that you can only do, maybe 12 to 15 reps of, okay, now you're going to be starting to get some of those benefits, right? Now we do want to adjust those a little bit for somebody who has osteopenia versus osteoporosis, because somebody with osteoporosis, so that T-score less than 2.5, right? Or more than 2.5, is more at risk of a fracture. And so they have to be a little bit more careful, right? So they're going to go kind of in between, not that way low intensity, but not as high intensity maybe, or at least want to really be careful about working their way up. And I'll send these slides to Rebecca, and she can, you can take pictures if you want, but I'll send the slides to Rebecca too, and she can send them out to anybody who asks for them. So, either way, some sort of weight-bearing aerobic exercise 3 to 5 times a week is recommended. So weight-bearing, thinking of like being upright on your feet, right? Walking is just a really good, easy one, but anything, even something like dancing, hiking, other things like that can be good to get that the cardiovascular benefits and the bone benefits, right? Versus, cycling and swimming and those things are good for your heart, but they're not really doing anything for your bones, so not bad things to do, but it's, if you have low bone density, you should be trying to think about more weight-bearing aerobic exercise. And then resistance training 2 to 3 times a week. And I mean, these are really actually recommendations for just about anybody, whether you have low bone density or not, but it's especially important if you're trying to improve your bone strength, and muscle strength also goes along with that, which we'll talk about in a minute. But and it's just the intensity levels that vary. If you have more bone loss, you're going to back off the intensity a little bit, right? Only getting to 40 to 60% of your max heart rate and doing a weight where you can do 12 to 25 reps before fatiguing. And if you have osteopenia or just are kind of at risk for lower bone density, then you can up that intensity a bit to a weight where you can only do 5 to 12 without fatiguing. And you can get up to that 60 to 80% of your max heart rate. And you can do a little bit of jumping if you're osteopenic. And for osteoporosis, that's not recommended, but we'll talk about that a little more in a second. And in addition to exercise, there are other things that you can do to help support that. And we're not here to talk a lot about that today, but just wanted to mention, I mean, obviously there are medications, and that's a thing to talk to your doctor about. That's going to depend on where you are in treatments and in everything else of what goes well with the other things that you're doing. But there definitely are medications out there, and of course supplements too. It's another one to talk to your doctor about what supports the other things that you're doing there. But some things that you can do, definitely nutrition, and then relaxation and sleep are all things that make a really big difference for a lot of things, bone density included, right? So we need, in order to make good, healthy bone, we do need the nutrients from our food, to do that, right? So a balanced diet with lots of plants, fatty fishes, omega-3s, dark leafy greens, tomatoes, beets, peppers, citrus, all of those things have really important minerals and nutrients in them to help build your bone, right? So that's one thing that can be pretty important. And then something we don't think about as much sometimes is relaxing and having good sleep. And the reason for that is because if we have elevated cortisol for a long period of time, that can actually impact a lot of things, including our bone's ability to make new bone. So if we're not getting enough rest, if we're not treating our bodies well, that's going to make it worse, right? So something to think about, when you're thinking about the whole picture of all the things that you want to try to do to support your body and your bones, you don't want to forget about that part. But let's talk a little bit more about specific types of exercises, that we can do to help with osteoporosis. So first, I just want to say, I mean, there's not only one right way to get there, right? And the best exercises are going to be the ones that you actually enjoy doing. So if you can find a place where that crosses over a little bit, where it's something that you actually like to do, but that also is going to help support your health goals, including improving bone density, that's the place we really want to be, right? So, I mean, weight training is kind of an obvious one. That's a traditional one for osteoporosis that definitely is helpful, just having resistance, right? But you do want to make sure you're careful with that. When you're adding weights, you need to be doing that safely. So if that's not something you've done before, you want to make sure you're consulting with somebody, a physical therapist preferably, about how to do that appropriately. And but then once you are starting to do that, and working your way up, you want to work your way up to a place where it's actually somewhat hard, and not just the things that are easy. Yeah. But aside from weights, you can actually get quite a bit done with resistance bands and body weight exercises. And that's the stuff we're going to go over today. Some things that are pretty easy for everybody to do at home. And it's still, you can be creative for how you're providing resistance. It doesn't have to look like a physical weight, right? So we'll show you some of that in a little bit. And then even there's good research on Pilates improving bone density. And that's not one you'd think of because you don't think about that, the resistance there, but there really is a lot of resistance in Pilates that you're doing, and a lot of focus on core strength and health that can be good. So if that's something you like to do or something that feels more motivating, then that could be a good idea. And then again, weight-bearing aerobic activities are really helpful. So walking, dancing, and even stuff like gardening, stairs can be good. Also to mention on the walking side and just the weight bearing, there's definitely, I don't know if any of you have heard of people using weighted vests or um, a, even a backpack. Yeah. I don't know why that word didn't come to me. A backpack that's close to your back, maybe with a little bit of weight in it. It's called rucking. I mean, that can be a good addition too. Make sure that you're conditioned to just walking without those things first, and then you want to slowly build that up. But there is some good evidence that that can be helpful, especially for your spine health, which is the one that's really hard sometimes to target in other exercises. So that's definitely something to think about. And you don't have to go out and buy a weighted vest. I mean, honestly, a backpack with a little bit of weight in it, as long as it's close to your body, I mean, is going to do the same thing. So just put a few water bottles in your backpack and good to go. And then the other one that we wouldn't necessarily think about first thing for osteoporosis, but has been shown to be helpful is Tai Chi, at least for reducing the risk of fractures, because it helps so much with balance, So, and I mean, I would put yoga on that list too, in that category, right? For helping with balance. So we want to think about that piece of it too, because since our main risk that we're worried about from osteoporosis is the risk of fracture that usually coincides with a fall, you want to be trying to work on something that's doing balance in addition to doing something that's strengthening your bones if you can, right? I mean, the ideal would be to be doing some kind of weight-bearing aerobic exercise and some kind of resistance or weight training and some kind of balance, training too. That might sound like a lot, ideally. But if you can do any of those things, you're still helping yourself, right? So then what you should avoid. So this is kind of important, what you should avoid, especially if you end up, going to an exercise class or a yoga class or something that is not geared towards people with osteoporosis, or maybe just is by somebody who doesn't really know what things they should avoid for that. Then you want to be really aware, right? The main thing is to try to avoid a lot of what we call flexion or curling of the spine, right? So it doesn't mean you can't bend forward. Yeah, sorry. One sec. And we're about to switch to exercises anyway. She's got to get the camera so they can see me. Sorry. I keep forgetting that you guys are here too. We're ready? Okay, you can see me. So the curling of the spine, which let's see, is what you want to try not to do, especially with some kind of weight on the end of that. But it is okay to bend forward from your hips, yeah? And the worst is to curl and then twist, right? And then especially to then have some kind of weight there. So those are the main things that you really want to try to avoid. But then knowing how to do those same kind of movements safely is important, right? So again, like bending at your hips, and then, you can reach down, but with my spine straight and flat, and I can bend my knees and my hips, right? Instead of, I don't think this is doing anything, is it?
No, I'm gonna try to do it once you move.
Okay.
I'll take it, yeah.
Is that because of risk of injury? Or what's the
Risk of fracture in your spine. So it's particularly for anybody with osteoporosis. People with osteopenia should be able to tolerate some flexing of their spine, but I'd still avoid flexing and twisting. Oh, thank you.
Yeah.
You're gonna need that too if you're gonna get that to work. Good eyes. So those are the big no's that you want to try to be super aware of if you go into any kind of community exercise class or anything like that, right? And training yourself to be able to, bend from your hips and your, at your waist essentially, right? Instead of from here, is important awareness for you. And then for people really with those higher T-scores, running is really not the best idea. You might be able to do that, though I would check with your doctor if you have osteopenia. but it may depend kind of where on that spectrum that you are. But for people with osteoporosis, running is that repeated impact over and over again. You could get a stress fracture that way, right? And then higher impact sudden movements are also a type of thing you'd want to avoid. So like we said, maybe a little bit of jumping is okay for people with osteopenia. Like one of the things sometimes people recommend is those little trampolines, you know, and then like doing little bounces, like that would be fine, you know. But you don't want to be like doing crazy, you know, like the girl in that picture there, you know, you know, crazy things where you're, and then especially where you're gonna like land weird or, you know, don't do that. Because again, higher risk of fracture, right? When you're in kind of a weird position and putting impact on it, yeah. And so again, instead of running, you know, or jumping, leaping, those kinds of things, try walking, rucking, dancing, hiking, you know, those kinds of things, which are still going to get that weight bearing benefit without the like heavy impact, yeah. So now we get to the fun part. Are you guys ready to exercise with us too? Let's all do it together.
For those online, give us a few minutes while we.
Give us a couple minutes,
Yeah,
we'll
but we'll be right
reset.
back.
Okay, you tell me when we're ready. Patience, everybody. Couple of these, the exercises here. Obviously, you're set up to do at this moment. Correct. Sitting, standing, dead. Okay. Gives you some more options, you know, anyway, if you don't want to get down on the floor. The first one that can be really helpful, especially at the end of the day, is called compression. So this one's one that we can't totally accomplish sitting, but we're just going to try to get the idea of it. And you would lay on your back with your knees up and your feet flat. Okay. But right now, what you're going to do if you're here in this room, although if you're at home, you can do that, lay on your back with your knees flat. But if you're in this room, you're going to kind of sit on the edge of your chair a little bit so that your feet are flat on the ground. Yeah. So adjust your chairs if you need to a bit there. Good. And then you're going to sit up nice and tall. Okay. So what we're trying to do, and especially if we were against gravity, we could do this even better, but is to lengthen our spine essentially to take some of the pressure off of our discs. Oh, thanks. To take some of the pressure off our discs. So gravity throughout the day is going to slowly, you know, shorten your discs. I mean, you actually literally get shorter by the end of the day, right? If you were to measure at the beginning and the end. And that's because overnight what do you need? Okay. And that's because overnight your discs get a chance to decompress and your spine gets a chance to decompress. And so, and having that space for these discs that are in between your vertebrae gives it a cushion, which is going to help with fracture risk, right? And the other thing that's helpful is to be lining up our spine, you know, because if I turn to the side here. Okay, pause. One moment. Audio stuff again. Okay. I'm hearing myself on there though. Freaks me out. Tell me when we're good.
Can you do testing 1, 2, 3?
Testing 1, 2, 3. Can you hear me?
And I'm going to
Online?
stop the screen share so they can just see you.
Okay.
So the mic.
I need that, but I'm okay. I'll just switch it because I need to see it.
Oh, the list. I can bring it up for you.
No, I've got it right.
Oh, you do.
Okay. Okay. So where were we? Oh, yes. So spine being in alignment is helpful, right? Because our spine naturally, we have a lower lumbar curve, right? And then we have the thoracic curve and then our cervical curve, right? And they go opposite of each other. You know, if you can picture the spine in your head. And that gives us some suspension basically, right? For forces. And if we're here, then we don't have that suspension in place, right? Then we're putting a lot of pressure on our spine, on the outsides of our spine, instead of through the middle where it can take it, and where those discs can absorb the force. So part of the idea of the decompression is just having your spine in alignment. And part of it is to try to lengthen, right? So if you're laying on the floor, or for you guys that are sitting in the chair, just think about lengthening your spine in a way that you're not trying to force your shoulders back, right? And you're not trying to arch your back. So you're not thinking about lifting back, you're thinking about lifting up, like as if there was a string coming out of the very top of your head, lengthening you. And if you're on the floor, you're going to be thinking about that same thing, almost like you're pushing your head and your feet away from each other, and you're just trying to decompress those discs of your spine and get things into proper alignment as much as is possible, right? If you cannot achieve that position for some reason, that's okay. You want to get as close as you can and do it there, right? So let's say you're on the floor and you cannot lie all the way flat with your head on the floor. I mean, use a pillow for now, but see if you can slowly start to get less and less support there to be closer to flat, okay? So that's the first one. The next one is another one that we would normally do laying on the floor, but we actually can do this in the chair pretty well. It's a dead bug. It's an exercise for our core muscles that's going to help to stabilize our spine and to help give a little bit of resistance through your spine. So when we're in the chair here, am I pausing?
No,
again?
not a problem.
Okay. When we're in the chair here, what you're going to do is you lift opposite arm and leg, but keeping your core tight and keeping that long spine, yeah? And then you switch. And you can see how I'm not like moving way side to side as I do that. I'm staying, lifted up, and I'm keeping my belly tight. And that's how you're going to get the benefit of it. If you're leaning against I could do this all day, right? I'm doing nothing, right? But, but if you're actually sitting up and trying to maintain that long spine and using your abs, you might actually feel a little something, And if you're on the floor, you're going to get even a little bit more than this. But this helps to activate the right muscles and get things kind of going. Yeah. Are people feeling it? Does it make sense? Yeah. Okay. And the next one is another one that we're going to have a little trouble in the chair, but we're going to try. Ideally, if you're at home, you'd want to try to lay flat down on your stomach for this. Okay. And again, you guys can review this video later if you want to see me do it. But, and what we want to try to do, you're trying to activate your back muscles, right? So for us right here, right now, you're going to start in that nice upright position where you are in decompression. And you can either put arms up behind your head or over your chest and just lean back, but from the upper part of your spine here. Okay, so not overarching your lower spine, not leaning back like this. You want to and it might be a really small movement, but it's just this part of your spine right here leaning back. And you should feel those muscles in your back, right in that upper to mid back, activating there, And if you put your hands behind your head and you want to give yourself a little resistance, you can do that. And that actually helps to activate those muscles a little bit. And this is a really good one for using those muscles in your back, in your spine, can be really, really helpful for the bone density in your spine itself, right? Which is one of the ones that can cause a lot of problems when you have osteoporosis there. So this is a really good one. And if you can get down on the floor and do it, there's a lot of good benefits to that too, because that's also really helpful for maintaining your spinal alignment to do that exercise, okay? Now we are going to stand up. So for everyone in the room here, if you can, try to come behind your chair, push your chair in maybe, where you can hold on to it. That's if you're online. You're mostly there. And so we're not gonna have tons of space, but we're gonna just kind of do a little bit so we can get the idea of it, right? So this one in the video, I demonstrate on hands and knees, but we can actually do it by just leaning a little bit on the chair here. And remember to not arch through your, not round through your spine as you do that. You're just leaning your whole body forward, just a tad. And then you're gonna lift one arm and the opposite leg without hurting your body, right? So we're not like doing this. So it's not gonna lift a lot, you know, just there and then back. And what you're trying to do is keep your spine straight and stable, using all those good muscles right around it as you alternate arms and legs there. Good. And try especially not to arch your back as you do this, right? That's a good way to, we're not ballerinas over here. You really want to be actually just squeezing your glute a little just to lift that leg and keeping your spine straight as you do it. And making sure that you're not rotating. That's the other big one. So it's actually fairly hard to not rotate at all as you do that, yeah? Okay. Got it? Yeah. So next, we have a squat. So if you're at home, this is one where if you are okay to use weights and you have some kind of little weight, it is helpful to add a little bit of something. So, you know, when you're at home, you could just grab like a gallon jug out of the refrigerator, or, you know, a liter of water or something like that, just to add a little bit of resistance to your spine. But we want to make sure we're doing the squat in an appropriate way, right? So, and not bending through our spine. So you're going to bend at your knees and bend at your waist, like you're going to sit back in a chair, but don't overarch this way either. You want to keep your spine straight and then come back up, right? And just pretend you're holding a weight, or if you're at home and you want to grab something, you can. And here, we're getting a little bit of good resistance through our hips and our femurs and our spine at the same time. So for people who have lower bone density in their hips and through their spine, this can be a really good one, but just make sure, you know, you're not doing anything that hurts, right? So especially with a squat, a lot of times people have a problem with their knees, you know? So if you're having that problem, couple things. One, if you go back instead of forward, that should help a lot. And then the other one is to just not go down so far. It doesn't matter that much. You don't have to be way down here, you know, that's not totally necessary. You're just trying to, just a little one still accomplishes the thing you're trying to accomplish, right? Especially if you're adding a little bit of weight to that. And the weight should be held really close to your chest too, or your belly, just close to your body. You know, if it's further out here, that's putting a lot of torque on your spine, which isn't going to be super helpful. By your side would be fine. Okay. Yeah. Something close to your body. Yeah. So here, 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 whatever, but not here. This is only 5 pounds and I don't have osteoporosis, so I can do that. Okay. Yeah. No.
About knee position.
Yeah. Oh, and knee position, not only as we're going this way, we want our knees to stay relatively over our ankles. They'll come forward just a little bit, but we definitely don't want them to come here. We want them to pretty much stay right where they are. If you're bending your hips and bending your knees aren't actually moving much, right? And then the other important thing about your knee position is if you're facing me, don't do this, the coming in. Can you see that on the video? Yeah. Let your knees come in, don't let them go out. I want your feet parallel to each other and your knees are gonna just, you know, right in line with that. Yeah. Thank you for that. Any other questions about the squat specifically? Okay. Next up, so this next one is kind of helps to work on some of your hip muscles. So again, can be really helpful for people with osteoporosis in their hips, but also is good for balance too. So this is one where you may want to hold on. You guys might have to turn to the side because we're gonna do this. So, and again, just like all these others, the point is to try to keep your spine stable, keep your belly muscles engaged while you do this little march. And if you can do it without holding on, great, but it's nice to be next to something just in case. And if you need just like a finger or something, or if you need to hold on a little more, that's fine. You want to use the least amount of support that you need while you just slow and controlled legs up and down. And you should feel when you're on one leg, your other hip supporting you a little bit. If you're raising your hip like this, you're not going to feel that. If you're dropping your hip like this, you're not going to feel that. So you want to try to keep, and in fact, if you don't need your hands to hold on and you want to put them on your waist, it can be helpful to cue you if you're doing this or a mirror or something, right? Which, no, there's a mirror for some of you in the back. And just nice, slow, controlled, trying to really feel your hip muscles supporting you when you're on one leg. It's about the leg that you're standing on. It's not about the leg that you're lifting. You know, that's what you're trying to focus on. And really trying to minimize the side to side movement, especially this. I don't see anybody doing that. I'm just, you know, it's an exaggeration, but trying to keep thinking about that string coming out the top of your head while you know, do your little marches. Yeah. And just staying as straight and stable as you can. The next one, we're gonna have to be creative in here with, but I'll show you at least, and then you can see how much you guys can do, is again to help work on some of those hip muscles. So if you have some sort of resistance band at home, that can be helpful to add a little bit to this one. And so what you would do is to tie it around your knees. And then you're going to get into a little bit of that squat like we did earlier. So again, remembering that we're going back. Take that off so you can see. We're going back like we're sitting in a chair. We're not doing this. But this is just a little baby squat. So we're not way down here. We're just here, okay? And then from that squat position, you're taking a step. And you would kind of take a few steps in one direction and a few steps in the other direction, but we don't have space for that, so that's fine. It doesn't actually matter. And when you take the step, your positioning is really important there, okay? This is where your feet need to stay parallel with each other. Your knees need to stay in line with your hips, and you want to feel it coming from the back side of your hips, not the front. And I'm telling you a lot of things, but I promise I say all these things in the videos too. So I think most of them, you know, so you have it there again too. But the other thing is you don't want to be, it's not up and back down. It's not this. You're staying in the squat to keep your hips activated while you step, you know, one way and then the other way. Yeah. Make sense? Any questions about that one? Okay. So I think that's the last of our hip ones. Now we get to our arms and shoulders, and some of this is good for your spine as well. And so push-ups, I actually don't have you doing on the ground even in the video, so we're good. If you have at home, you can pick a surface that feels like the right surface. The higher it is, the easier it's going to be. The lower it is, the harder it's going to be. I'd start with something that's a little easier and make sure you can maintain the right form. So here, we're just going to use the back of the chair, but be careful if there's nothing in front of your chair that you don't have. So just don't put a lot of weight on it because this isn't real stable, okay? But what you want to do, you want to shift your weight to your toes. And you're trying to keep your whole body in one line while you just let your trunk, let your whole body come forward and then back. Keeping your belly really tight and that spine just totally straight, elbows close to your body. And you want to start to feel, and when you have a more stable surface, you'll feel this even more, but You want to try to feel pushing through the back side of your shoulder when you push away, you know? And so, again, have it feel like a plank when you're here.
On the wall.
You can do it on the wall too. That's going to be even a little easier if you're on the wall nearby.
We can do it.
Oh, so wall, you know, you can do there too. Did they get that or not? Okay. Yeah, I mean, the wall is probably it's gonna be your easiest, and then doing it down low somewhere is gonna be your hardest. But I'd suggest rather than like going down to your knees or something like that, just find the surface that's the right height so that you can really work on that whole body being in line and that you're really moving, you're using your body here as resistance, right? And gravity. And work on that whole, really feel like you've got that plank thing going, you know, to start with, and that you maintain it and that you're not coming here. And again, being careful of this, because that's the one we really, really don't want, right? Push-ups, we did that. Okay, so next, this one, so this one you want to be careful of if you have osteoporosis where that T-score is more than 2.5, then you want to be really careful with this one and not do a really big range of motion. But it's called a chop. So you're going like this, okay? But you can see really, I'm not actually moving that much through my spine. I'm letting my hips do the movement, right? My hips and my shoulders. And even if I switch to just one hand, if you're worried about more rotation, one hand is going to give you a little less rotation, but still give you the muscle activation there, you know? And of course you do it on both sides. So you start down low on one side and go up to the other side. And just be careful not to way extend through your spine, you know? We're not practicing our golf swing here quite, you know, this thing. And if you don't have a weight or don't want to use a weight, a band works well for this one too. You would just step on it. Can they see my feet? Yeah. Step on it and grab it and start with it down low across from you and just come up. And again, you can see I'm really moving more from my hip joints than from my spine, right? If my hips just stay here and I just through my spine, I'm doing a lot of twisting. But if I let my hips move with it, then I'm not actually twisting my spine that much, but we're still getting some of those rotator muscles that are really important for stabilizing your spine and your shoulder. So I'd say you need to be really careful with this one. And if you're not sure, I would skip it. But it can be really beneficial if you can figure out how to do it well, because it gets some muscles that the other ones don't. And then of course, if you haven't done it on both sides yet, go both sides. This one, I do think it really helps to have some kind of resistance. So at least, you know, if you're at home, pick up a water bottle or something so that you have something, you know, so make sure it just helps you feel like you're actually activating your muscles a little bit more. And again, when we are talking about bone density and exercises, eventually, once you feel good about the exercises, you want to get to a place where you actually are feeling, excuse me, fairly challenged, you know. But you don't start there. You start easier and make sure you feel comfortable with the movements, make sure your body eases into it. Any kind of exercise, you want to do that. You want to ease in, which sometimes means taking it slower than we really want to. I mean, a lot of times we have memories of things we did in our 20s, 30s, 40s that we were able to do and like it was fine and we just bounced back, right? Maybe not in 40s. Bouncing back. But you know, I mean, when you're 20, you can go out and do something you've never done before, and your body has so much elasticity and everything that it just bounces right back, even if it was something you probably shouldn't have been doing based on where your strength levels were, right? But with each passing decade, that level of bounce back gets harder and harder, and you're more likely to injure yourself, right? And then especially if we have any kind of osteoporosis or osteopenia, the consequences are higher there, right? You know, if the injury involves a fracture, that's harder to recover from, you know, so just be careful, be safe, do things slowly. With two more. So these next two, we won't be able to do real well in here, you know, but we'll just model the movement. If you're at home, you would take a band and it's rows, right? It's gonna pull it right to me. So I'll demonstrate it, but not actually do it. So, but just, you want to put your elbows at your side and your forearms parallel to the ground, and you're gonna pull straight back while keeping your belly engaged so that you're not doing this, right? And just straight back. Also make sure that you're not shrugging your shoulders like this. You want to just pull straight back, and everything else stays where it is. Yeah, so that you're just working those muscles behind your shoulder blades, like you're pinching your shoulder blades together as you bring your elbows straight back. And try not to go like this either. Keep them really tight and in. And actually, I can feel those muscles working even without any kind of resistance, yeah? So, but you can add a little bit, what you would do, you know, put a band on a doorknob, preferably not a door that opens towards you, unless you have it really well locked. Just, you know, basic safety tips. You know, but on a doorknob or some other heavy thing that you're not gonna pull over as you pull on the band, yeah? Last one that we have for our little routine is another one that you might try to do with a band, but we're not gonna do that today. It's called a lat pull down. So if you had a band, you tie it up somewhere high, and then you would pull it down. And your spine here is pretty straight. You're just going straight like this. If, depending on where the band is, you need to lean forward just a little, that's okay, as long as you're leaning from your hips and not from here, okay? But I wouldn't lean way forward, you know, only a little bit, whatever you need to kind of get the right feel of the band, you know? And so try it a couple times, and where you should feel those muscles right in here, like on the sides, right here. And keeping your shoulders away from your ears the whole time, so that we're not reaching way up here so that our shoulders come all up, only as high as feels comfortable. It's really not that important how high you lift. It's more about getting some resistance on the way down, you know, and keeping your elbows in towards your body. You could use light weights. I feel like it works a little better to have more of a pulling motion than just a lowering motion. So it'd be better than nothing to have light weights, but I think a band in this case is actually quite a bit better. I know, that's what's hard. So, you know, if you don't have a place that makes sense to tie, it is harder to find a place to tie a band up high than down here. So, I mean, I've done like, you know, if you tie it in like something here, and then put something on the other side, and then put that on the other side of the door, you know? Oh. Yeah. With the, again, make sure the door does not open towards you unless it is really well locked. But that'd be another way that you could do it. That's kind of the best. It's where I usually am able to find a spot, is to get it into the top of the door. Yeah. But just make sure it feels pretty secure on the other side. Okay. All right, you guys can all sit down if you would like. Should we switch back to the slides?
Yes, absolutely.
Okay.
Yes, we're back.
We're good? All right. So just once again, there is a YouTube link there and a QR code that is those same exercises we just did. It's about 20 minutes long. It's really the whole, you know, doing kind of one set of each of them, you know, which is a good place to get started. But then, you know, if you want to really start to push to where you are doing the recommendations for exercises, you'd want to do 2 to 3 sets of it throughout the day. And about 2 to 3 times a week, right? Back on those other slides. Okay, let me see here. There we go. Okay, so let's talk a little bit about what am I? Okay. About needing some guidance and some help where you would go to look, right? And when you would go to different types of people. We have a couple of the different options up here, but then there's others out there too. So physical therapy is a good place to start to get an assessment of where you're at, get some safe movement training, have somebody with their hands on you to make sure you're doing things the right way. To avoid any kind of injury. And then, of course, if you have any sorts of existing injury or pain or mobility issues that are getting in the way of doing things the way that you would like to be able to do them, you want to go to somebody who knows how to either modify exercises for those things or who can help work through those issues, right? And somebody who knows how to prevent falls and those things and can add in some strategies for that. For some people, the obstacle is not knowing the right things to do, but it's doing them, you know? I mean, we all know we're supposed to exercise, right? You know, but are we doing that regularly? And so there's something called health coaching that's for that side of things too, right? And that's if you're trying to figure out how to find your motivation, your consistency, if you have a lot of fatigue and it's hard to figure out when and how to fit in these exercises, it's just somebody helping you to talk through those things, you know? So that's another option. Things that are not up here on my slide, you know, personal training, any kind of group exercise classes, any of those things. I think those can be good to just help you get into a routine if you already know the things that your body should do and shouldn't do, you know. Most personal trainers aren't going to have any kind of education in osteoporosis that I know of. I mean, I would ask a lot if they say that they do about where they got that training just to make sure that they know how to do things safely. And then certainly in just your average yoga, Pilates, whatever class, I mean, they're not going to know. I was in a yoga class last night, in fact, where the whole time they had us rounded like this. And I was looking around like, I hope there's nobody with osteoporosis in here. This is awful. What? Yeah. Oh, yeah. It was a restorative class and she had us bent forward like this for like half the class. Yeah. I stopped at a certain point. My back didn't like that either. But but I mean, those are the things you're going to encounter it just out in the community, in the public, right? People who don't know what are the right things and what are the wrong things. And if you know what are the right things and the wrong things, you can still modify and go to those places and figure it out. And it can be nice to have the accountability of like a class to go to every day or, you know, 2 to 3 times a week or whatever, or a trainer that you're meeting with, you know, and a trainer to help push you to actually be lifting that amount of weight that you need to improve your bone density, you know. So those can definitely be good things, a personal trainer or classes or whatever, any of those kind of community things. But just make sure that you already know how to do things safely because you need to take responsibility for that and not be trusting somebody else unless it's a medical professional. And even then you still need to take some responsibility for your own health too. So a little bit about that, and then that's it. So we're gonna open up to questions, but I want to tell you about some of the resources I have on here real quick. There's a little box there that has where you would find a PT. ChoosePT.com is a good place to look. Specifically for osteoporosis, you want to look for somebody who is board certified in women's health, orthopedics, or geriatrics. Any of those people should have pretty good knowledge of what to do for osteoporosis, but I will not say that your average PT off the street really knows that much about it. So I would be a little bit choosy there and try to find somebody who has that extra board certification that knows a little bit more about it. And on that website, you can filter, you can choose by one of those specialties. It'll show you what specialties they have, right? If you're somebody who is needing a little bit more help with the motivation and kind of how to change your routines, I have an ebook about that I put a little code there where you can get it for free on my website. And that QR code goes to that. And then the ebook, the code there, Start My Journey. So if you wanted to read a little bit more about kind of how to establish health routines, you know, to improve. If that's a thing that you struggle with, that's a place to look there. Now, I think that's all the resources I had. Questions? And isometrics. So the question is about isometrics. And I mean, isometrics are activating muscle, but not, I mean, it depends on if there's resistance or not, right? So it can be okay if there's resistance with it. So, I mean, isometric just means that it's not, that resistance isn't changing, right? But it's still, you can still have resistance. I mean, essentially that's what, if you're wearing a weighted vest or a backpack or rucking, I mean, that's kind of an isometric exercise for your spine, essentially, right? So it can be helpful, but it, like I said at the beginning, there's a lot of different roads to get to the same place. There's not one set of correct exercises and then all the rest are wrong. There's only those couple of things that you need to avoid, and the rest of it, I mean, great for Bruce Lee. Yeah.
Thank you. So we
Yeah,
have a
online.
question online,
Mhm.
if you're able to.
Mhm.
I've read that calcium intake, specifically milk products, may not affect bone strength. Can
Yeah.
you comment on that?
Yeah, I mean, I think there's a lot of mixed research on that. I think it just doesn't come down to calcium alone, and it's that broader nutrition that's important, you know. We need calcium, we need vitamin D, we need iron, we need fish oil, we need, magnesium, we need a lot of things. It's not just calcium. So in isolation, yeah, I can imagine that that's not super helpful.
Thank you. Next, so with osteoporosis, is jump rope bad? How about fit boots?
I don't think I know what fit boots are. Jump roping, again, if you have that T-score of 2.5 or greater, I would be checking with somebody for sure before you're doing jump roping. That sounds like kind of a dangerously impact activity for, I mean, if you were to fall, you could break your hip, right? So I wouldn't recommend jump roping. For osteopenia, it might be okay, but you'd want to check with your particular provider before you did that.
These are fit boots. I don't know if you want to comment.
Oh, fit boots.
Okay.
Yeah, I don't know enough about
Okay.
that to comment.
One moment.
We have one in here too.
Yes. So, do you know about OsteoStrong? Do you have any?
OsteoStrong, that is a good question. I think there's some decent research on it. And I know I have a lot of patients that do it. I'm not sure that it totally makes sense to me, that alone is going to improve your bone density, but they do have some decent research to show it is their research that they've done. So, I mean, I don't know. It's definitely not harmful. It's not cheap. I would really recommend that you just exercise. I feel like OsteoStrong is trying to be kind of a shortcut to be there, and maybe it gets there, I don't know, but by doing resistance training, you're also improving your muscles and you're improving so many other things, and I think that that's just a better way to go, but it's not bad.
Can we go back to the slide with the YouTube video? With the QR
Mhm.
code?
Yep.
Perfect. And then last question online, and we'll go to the in-person ones. Would jogging or foot stomping be safe for osteopenia?
Yes, so jogging should be okay for osteopenia. Foot stomping should be safe for osteopenia. I mean, again, if you're doing really vigorous jogs or anything like that, you might want to check with your doctor first just to make sure. But for most people, that's going to be pretty safe.
Well, we can take a few questions in person before we close out today. Yes.
Is the REMS more accurate than DEXA scan? My endocrinologist told me that it's actually, DEXA scan is actually really operator dependent. I didn't realize. And how often should you get a bone scan?
Can you repeat that for those?
Yeah, so for those online, the question is about the REMS and whether it's more accurate than DEXA, and how often you should get scans. The REMS is kind of newer, so I think there's just not as broad of research on it, but I was looking at a systematic review of a bunch of studies, done over the last few years, and from everything I'm seeing, the REMS seems more accurate, actually. The DEXA does seem really prone to error based on things like having arthritis in your joints, which, I mean, I mean, who has osteoporosis and doesn't have arthritis? Like, not that many people, right? Or your BMI or things like that. So from what I can tell, it seems like it's more accurate. Usually recommended about every 2 years. There's not danger in doing it more than that, really. But I mean, the other big downside of the REMS, I don't think any insurance covers it that I've seen. It's maybe like a couple $100 to do it. There's a group coming actually using our clinic space on Monday to do a bunch of REMS scanning. And I think it's like $200 and it takes about 30 minutes, you know? And the other nice thing about it, there's no radiation, you know, which DEXA has radiation. No, DEXA has radiation.
Yeah, but it's so low.
It's low. It's low. So it's not that big of a deal, but it's kind of nice if you're going to be repeating a scan over and over again to not have radiation.
And does Ozempic actually work after 5 years or whatever?
I'm not going to comment on medications. Yeah.
It is 2:04. Do you have a few more?
I have a couple more minutes if you want to take.
We have the last question
Last
here
question.
online. Yes, in the back. Thank you.
That's you.
Betty. Can you repeat that for online?
So the question is, for severe osteoporosis, can she do hula hoops? Maybe. I would want you to be doing that with, like, you know, have a PT look at how you're doing it and how you're moving and how strong you are to know if you could do that safely, because there is, you know, kind of twisting type motions that are happening there that I'd be a little cautious about. So not a for sure no, but I would recommend that you have somebody look at it if you want to do it.
Wonderful. Thank you so much, Dr. Shimanek, for just a lovely, informative presentation.